Hello, everyone. My name is Ariel Palitz. I'm the Senior Executive Director for the Mayor's Office of Media. No, I am the Senior Executive Director of the Office of Nightlife at the Mayor's Office of Media and Entertainment. Um, I just want to welcome you all into the room and to pass the floor over to Borough President Eric Adams, who invited us here today. Thank you.
Thank you, Ariel, and really thank your entire team. And I want to thank Evan Burr, and I see Josh is also on the line as well, the former member of my office and now part of your amazing team. And it's about answering questions. There's so many questions that we have during this time of COVID-19. And as we transition into the new norm of our nightlife spaces, and your office has been amazing in disseminating information and allowing people to know how to plan ahead. And so we wanted to use this opportunity to allow those who are in the field to get questions answered and to give feedback, because I'm sure many men and women part of the nightlife profession, they have some suggestions that will probably make our lives and our jobs easier as well. We all know that tourism is a major financial boost for this city. When you look at 65 million tourists visited the city last year, and $45 billion in economic stimulus that came from that. One of the most important aspects of our tourism is our wonderful nightlife. So we want to ensure that we do everything that's possible to continue to have a vibrant nightlife, but being safe at the same time. And so today, your input is really going to allow us to partner together, have a partnership together to figure this out. So again, thank you. And I want to thank the full team that you have with you. And let's move forward and have an enjoyable forum. Thank you, Ariel.
Thank you, Borough President Adams. Really appreciate the opportunity. I also want to just make sure that people understand you really reached out to us to really make sure that all of the hospitality businesses in Brooklyn are receiving the latest information directly from the city's agencies as we are making our way through this really terrible time in New York and this pandemic. I also want to take the time to thank each of the business owners that are taking time out of their day as you're fighting so hard to keep your doors open and to stay positive while navigating these really rough waters. I also want to acknowledge all of the people you see here on the screen right now, my partners in city government, from the Department of Health, the Office of Test and Trace, Small Business Services, the Office of Special Enforcement, and Oath. For this multi-agency town call to help address some of the questions and concerns that you have as these numbers are surging, and to help stop the spread really of this highly contagious disease so that we can start to resume life and business as normal as quickly as possible. The role of the Office of Nightlife is to be a convener, a dedicated liaison between the industry and the city to make sure you're getting the most recent information, and that is exactly what we're doing here today. But for those of you who may not know who and what the Office of Nightlife is, I just wanted to take a moment to make sure that you know that there is a dedicated office within this administration that is here to serve the hospitality industry, which means the owners, the workers, the artists, performers, the patrons, as well as the residents. We know that nightlife in New York is an ecosystem that is interdependent upon each other in order for it to work and for us all to thrive and survive. And so this office and the city recognizes that this industry hasn't historically had the respect, the recognition, the support and appreciation of what it contributes to this city. Before the pandemic, a $35.1 billion industry that supports 300,000 jobs. And we really need to do everything we can to return to that and then some, and to thrive even further. I wanted you also to know that this office is a non-enforcement liaison. And we are really here, our purpose is to make sure that we are finding and coordinating systemic solutions to some of the problems that we know this industry has historically had, right? So we are looking at how to identify what has held this industry back from getting the equity, fairness, safety, and support that it needs in order to work for all New Yorkers. And our ultimate goal is to make sure that nightlife is more fair, more safe, more equitable, and accessible for everyone. And in this office is just almost 3 years old, and we have a long way to go, but I really look forward to building this office to do that for this industry. A little bit more about what we do. This office operates through a MASH approach, which means a multi-agency support for hospitality, much like you see here today. So I want you to know, if you're having issues in your businesses with the fire department, with the buildings department, having trouble navigating those waters, you can reach out to us and we can help you to navigate those systems and those agencies if you're running up against a brick wall or things don't seem like they're going your way and you need extra support. We are here dedicated to do that for you. Office of Nightlife is also at the table every day, where the decisions are being made, amplifying your needs and concerns to make sure that you have a seat at the table every day, as well as delivering that information back to you. Some more additional helpful information, along with our city partners, we created a what to expect when you're being inspected checklist, as well as FAQs. They reside not only on our website, but on the Small Business Services website. We encourage you to look at it, to download it, and to visit it regularly, because preparation and education is the best way to ensure safety and also to minimize the interactions with enforcement at this time. If you are educated, we all know when we know better, we do better. And that's really what we're here today, to make sure that everyone here knows better so we can all do better. And that is why I have assembled everyone here. One more thing before we turn to our partners is I wanted to share a program that the Office of Nightlife created and launched just about 3 months ago in partnership with Oath and their Center for Creative Conflict Resolution. It is called MEND NYC. It stands for Mediating Establishment Neighborhood Disputes. We all know in the hospitality industry and in New York, we live and work very closely together. And there is a history of quality of life concerns between residents and businesses. Historically, through the 311 anonymous call system, they go in through complaint, and then we get visits through enforcement, rather than having an opportunity to really mend the situation, meet your neighbor, and find compromise through communication. And so we are very excited to be able to introduce this new program, and Commissioner Klesner will also be able to speak more to it. But just know, if you are also having chronic calls from a neighbor, we know that you want to resolve that. Sometimes you don't even know who they are. And so you can also reach out to the MEND program and say, I would like help to resolve a quality of life complaint issue I'm having with my neighbors. We've also expanded that program only in 3 months to help you also mediate conflicts and communication with your commercial landlord. It is a free mediation service. So know that you can reach out to MEND if you are having trouble contacting and communicating with your landlord to try to negotiate something in regards to your rent or your lease, and then to be able to bring that perhaps to an attorney and to really avoid costs in the beginning and establish communication. But this is something that we're very excited about and believe that it speaks to the approach that this office takes to find creative and systemic solutions to the problems that have historically faced this industry pre-COVID, and of course, when we inevitably get through it. So with all of that said, please know that we really encourage you all to reach out to our office, because we are here and we are stronger when we hear from you and can amplify your needs and address them. So with that said, I'm going to pass the floor to our city partners. We have really assembled an incredible group from the Department of Health. We will start with the Department of Health and Test and Trace. We are all in this predicament now because of the COVID crisis, and it's really important to understand, where are the numbers now? How can we help flatten this curve? How can we bring these numbers down? And what happens when you get it? What happens when your employees get it? And what will and won't happen? So I'm going to start this conversation by introducing Chelsea Cipriano from the Department of Health, as well as Risa Starr from the Test and Trace Corp. Thank you so much.
Actually, I think, thank you, Deputy Mayor, or not
Oh,
Laura. Mayor. I think I'm going to be doing the presentation with Chelsea, and then Risa will be available for the Q&A.
Laura, I'm sorry, I didn't realize.
No worries, no worries.
So Chelsea, you can kick it off. Oh, you're muted, darling.
Ready to get started. Thank you so much, Ariel. Thank you, Borough President Adams, for having us. I think I have a deck on deck. If we can pull up the first slide. Thank you. So Laura and I and Risa are here to be, the not fun part of this presentation. We know that all of you are keenly aware of how rough of a year it's been from a health perspective. I know many of us have had friends, families, and some of us ourselves have been impacted by COVID-19, but also from an impact on our, not just our lives, but our livelihoods. And I first just want to start by acknowledging that we are very aware of the hardship that you've endured this year. And I want to first thank you all. You all have been great partners in, helping us get the word out about the many requirements, the data as we've been seeing spikes, and really encouraging folks, your patrons and your partners, in following the rules. And we know that they have not been easy rules to follow. So I just want to say thank you and acknowledge what a rough year it's been, and just extend, for everyone watching, I hope you're all well and staying well and safe. I unfortunately do need to start with some bad news. We know right now these trends are really concerning. The numbers, you can see a really, really stark increase in this line. I do want to encourage everyone, this is all on our data page. These are screenshots. They're boring. They're not very fun to look at. Online, these are interactive. You can see it broken down by your zip code specifically. You can, get really deep in with the numbers. If you would like to be a public health data nerd like us, the numbers are not good, and these translate to people's lives and their well-being. So I just really wanted to show why we're so worried and why we're here today, continuing to ask for your partnership and making sure that you're aware of the resources available to you to help us drive these numbers down. I do want to just really quickly, before we move on to the next slide, just call attention to this gray bar. We get a lot of questions about that little dip down at the end there. That is not a true dip down in the data. It is just because we're updating the data in such real time that it's just incomplete data for the week. So thank you. That's my bad news slide. We can continue on to the next. This is also on our website. These are, I will say, this percent positive just updated on our site at just maybe 10 minutes ago. So this is data from yesterday. Today's 7-day rolling average of percent positivity is 5.32. And this is a new dashboard on our site that shows confirmed cases and probable cases. You've probably been hearing a lot about antigen testing. And so that is now rapid testing. They're counted on our website now as probable cases. And in the last slide that I just showed you, we don't have to go back. it is showing antigen tests as the gray shadowed part underneath the blue and the blue line. So I just wanted to explain that if you're on our site, looking around, checking it out, you can better understand the indicators. And we really want you to feel that you have this data at your fingertips, just like we do, and are empowered to play around with it, ask questions. That's what we're here for, to help folks understand the situation that we're all in. It's not a good one, but understanding the problem is half of moving towards a solution. So we want you to feel empowered to have this information too. As you can see, unfortunately, all of our indicators are increasing. That is not good, and we really need to drive these numbers down. Thank you. Next slide. This is just a snapshot, of Brooklyn. We wanted to pull out, this is all from the website. We just wanted to pull out the data pieces so you can look at your own zip code. Again, I'm sorry, I wish I could have updated this in real time. The data just updated on the site, so these may be a little bit different from these numbers, but they should just be slightly different. These are the percent positivities for everyone's zip codes. I think we can go to the next slide. Again, we're trying to get you data in as real time as possible, so it really is changing every day. Laura, I'm going to pass it over to you to talk about testing sites so that folks know what they have available to them near their.
Thanks so much, Chelsea, and thank you, Borough President, and everyone else who's joining us on this call. This is a really critical conversation to have. I know that information is coming at us really quickly. We're all sort of living this day by day and trying to learn as much as we can, and so appreciate everyone's patience with sort of the way that information changes and trying to adapt to it. I always like to do this as a point of reminder when I talk about the test and trace program, about where we came from and where we are. So if folks remember back to the really dark days of March and April, if we tested, 3 or 4 people a day, that seemed like a huge success. Testing was simply not available, at least in this country, for months. We needed it sooner than we had it. And even those who could get tested, they had to fit a very specific set of criteria. They had to have traveled to certain countries, and they had to have had very specific symptoms. We are now very fortunate to be in a city, in a state that has really prioritized mass testing. And so that means that anybody who wants or needs a test can get one. We have a few different modalities through which people can get tested. And I want to talk a little bit about that because I know there's a confusion about which test people should get and what different tests there are. So every week we put out these flyers. They're in multiple languages. We're showing you the ones in English. All of our links are translated in multiple languages as well. We just give you the ones that are in English for sort of ease of access. But if you go on DOHMH's website or on Test and Trace, you'll find everything translated. So the sites that you see on the left-hand corner of your screen, these are what we call our brick and mortar sites or our pop-up sites. They are not moving. They are here with us so long as we are going to be battling this virus. The sites that you see on the right hand fall into a few different categories. There's the Department of Health Quickie Labs, which those are also going to be with us. Previously, they were labs that tested for STDs, and we have switched them into COVID labs. These are by appointment. You can make an appointment online. All of the other sites I'm going to talk about are walk-up only. We wanted to make sure that there were as few barriers to getting tested as possible. And oftentimes when you have to make an appointment, you don't, it can discourage people from seeking a test. So we have a new form of testing. It's called microsites or self-swabs or self-tests. You may have heard about these. This is a really interesting, creative approach that we have to sort of put testing in places where it might be more difficult to build a site or to bring a van. And so we've done these in houses of worship. We've done these in NYCHA. We've done them in businesses. We actually had one at an eyeglasses store yesterday in Washington Heights. So if you have businesses that you would like to offer, if you want to become a self-swab site, we can definitely talk about that. Also, if you have a parking lot and you're in an area where you tend to get a lot of traffic and you'd be interested in hosting one of our vans, we're really scaling that program up as well. And so we'd love to talk to you about that. But so the self-swab site, it's run by Test and Trace or any of our funded CBOs. Folks can go, they just pull their mask down, they swab themselves. I know people get very nervous about this. We no longer have long swabs. I want to be very clear. New York City health and hospital sites only use short swabs, which are much more comfortable. So when people are swabbing themselves, they don't have to, work as hard. Then we have the mobile tests. Those are the vans. They move around the city. And what we're trying to really do with those vans is identify holes in testing, geographically speaking, and plug them with the van. So every week those move around, so do the self-swab sites, because we're really saying, okay, we have a good working infrastructure for basic testing coverage, but what are the areas that are a little harder to reach? And so these modalities really help with that. Now, I just will say one other thing on testing, and then we can move to the next slide. People talk a lot about the different types of testing, rapid testing, regular PCR, they'll call it. I want to be clear. We offer rapid testing at many sites in H&H, not all of them. The rapid test is, it's not a PCR test. It detects if there is virus present, but it's not as sensitive as the PCR. So I know folks are it's very attractive to have the idea of having a result back within 15 minutes, 20 minutes, totally understand it. It's not as sensitive. So at H&H, we give everybody both the rapid test and a regular PCR test. If their rapid test comes back negative, we automatically run the PCR test. So I know this can lead to frustration because somebody might get a negative result on a rapid test and a positive on a PCR, and people have already decided, the negative result is the result they're going to follow. I just want to really caution people. We are trying to make sure that the results we are giving are, as accurate as possible. And so I understand how difficult it is to think it's a negative and then to hear reverse information the next day. But we want to just make sure that everybody has what they need if they are COVID positive. And so that is why we do that. Now, I will also say that the PCR test, which is more sensitive, I know folks during the summer may have had, some bad experiences with waiting a week or 2 weeks to get their results back. New York City health and hospital sites turn around results for regular PCR tests in about 24 to 36 hours. So realistically, the gap between rapid test results and PCR test results is much smaller than it was in the summer. And I think folks should feel comfortable just pursuing a regular PCR test if that's what they are interested in. I think we can go to the next slide.
I'm on mute. So we will walk through this very quickly. It's a lot of text, but it's pretty simple. I will do this very fast and then really focus on what you all need to know as business owners and operators for your staff, for your patrons, how you can continue the great work you've already been doing, and what else we need you to do. So first, we need your help sounding the alarm about why we're concerned in voices that matter to them. I think, the message for the holidays has been really hard for people to hear about not gathering with folks outside their household or traveling, but we have to ask that people follow this guidance. It is so important. 2, there was a new commissioner's order recently issued to people over the age of 65 and those who have underlying health conditions to try to avoid non-essential activities. Those things, underlying health conditions, also include, things like smoking and having type 2 diabetes. So we really want to get across to folks that this is really serious and people do need to be taking more precautions if they're at risk. You have likely all heard our core 4 messaging about staying home if you're sick or if you've been exposed, wearing a face covering, keeping 6 feet of distance, and washing your hands. Know and embrace those principles. We have to ask that you keep doing that. I will let Laura speak about testing and tracing and these numbers below, but I also want to encourage folks to get their flu shot this year. And then after she gives you this info, I'll talk a little bit about what happens if you do have a case among your staff and employees very quickly so that folks understand the process for that. Go ahead, Laura.
Do we want to go to the next slide?
That sounds great.
All right. Okay. So the goal of testing is not just for people to find out that they're negative and then go, to have a big Christmas dinner. That's kind of the exact thing that we're trying to avoid. The goal of testing really is when folks are test positive, and we know this can be a really scary time. This can be a time where they feel very anxious. We want them to know that New York City will support them in anything they need to make sure that they can safely separate. We are still learning a lot about this virus, but what we know about it is how critical it is to separate early on. And we want to make sure that whatever you need to separate, we can provide that for you. So New York City has a lot of really crammed housing. Many people have 4 or 5 roommates. If you share a bathroom, if you share common space, you might not be able to isolate. And so we have hotels available for anyone who tests positive and can't isolate. So really, testing positive for us is about kind of unlocking all of the resources that are available through the city to help us combat this. It's really about breaking chains of transmission. And so another thing I would say about tracing, because I know this comes up a lot, when we call somebody who has tested positive for COVID, what we're really looking for is who they have been in close contact with, and not so much where they contracted COVID. I know this is a frustrating point. Most people just don't know where they contracted COVID unless they contracted it within their own home. So this is something that I really want to emphasize, because we hear this a lot, that we want to know, and we would all love to know exactly where transmission is occurring, but really important that we also know who you may have been in contact with when you were infectious, and that we get them the resources that they need. So I think we can go to the next slide.
Yeah. And I do think that 212 COVID-19 number is really important. I will show another number at the end of this presentation that, as business owners and operators under the New York State reopening requirements, which really mostly all come from the state at this point, you are required to report cases to the Department of Health if your employees test positive. So we have a number for you to call to make that easy. When you call that number, it's not, I think folks have these images of the health department like coming in jackets and locking the doors, and that's not what happens. This is to really, as Laura was saying, to stop transmission. It's to trace the contacts of people who tested positive and give you guidance on what you need to be doing for your employees. So it's definitely more intended to be helpful, so that you know who needs to stay home for 14 days or 10 days until they're better, and to be a resource for you. So we'll put that number up at the end, and you can take a screenshot or take a picture so that you know exactly what your requirements are as business owners and operators. We know this is scary and overwhelming, and so we want you to have what you need. Very quickly, we don't need to linger on this slide. This is just showing your holiday guidance and travel guidance. This is all on our website. We'll make sure you have these links. Next slide. This is testing. This is testing guidance. These are our, testing resources, when you should get tested, for frequency, and why you should get tested and when you should get tested immediately. This is our social, on our social media. If you want to help share about testing, that's all here too. Next slide. These are our core 4. People have seen them a lot, and we need to keep reiterating them. So I don't think I need to linger here long. Next slide. Great. This is the one. I just want to pause here for a moment, let folks take a photo of it if they want to. This number, 3 numbers up from the bottom, is the how to report a case if you're an employer and you need to call the health department and want to ask about, how all of this works and what you need to do for quarantine. You can call that number as an employer. If you are a person and you have general questions about getting those hotel services, getting the, free delivery food or dog walking or anything else Laura talked about, accessing testing services, or asking general questions about COVID-19, as just a regular New Yorker, you can call this number right at the top and get routed pretty much anywhere you need to go. So these are the links. Thank you so much, Ariel. We're here for questions. And we know this may not have been what you wanted to hear about today at the top of the day, but we appreciate your listening and your time and your partnership.
Really appreciate it, Chelsea.
Thank you. Ariel, I didn't mention, and you asked me explicitly too, and it's so important, and I want to make sure I hit it. NYC Well, we know right now is a very hard time for a lot of people, and we want to make sure that folks have the resources that they need for their mental health, and to make sure that they're staying well, not just physically, but mental health as well. So I will make sure I'll drop it in the chat. It's probably easier than not. I'll drop in information about NYC Well, the number to get resources regardless of immigration status or ability to pay, mental health resources from the city, and NYC Care, which is how you can access healthcare in New York City, again, regardless of immigration status or ability to pay. I'll drop in those numbers and those links. Won't take any more of your time, but I do want folks to be aware of these resources that we have in this time of great need. So thank you.
Thank you, Chelsea. I really appreciate you sharing all of that information. You know, a really big takeaway, I think, is that people should not be afraid to reach out if they have an employee or a patron that is diagnosed. That doesn't mean your business is going to be shut down. It is simply to help support the city understand and trace what is happening, and that's extremely important information. And I really want to emphasize the NYC Well as well as NYC Care, which is free health care regardless of immigration status and financial status. And really, all of us are really having a mental hard time, you know, right? It's hard to cope. And so I think prevention is the key, to reach out before you go down too far. It's going to be a long and cold and dark winter, and we need to preemptively make sure that we are going to be in a good, positive mental state as we get through this. And if you are down, that there are free resources for you. So I really just wanted to emphasize that. And thank you again for sharing that information. I lost my screen. I just want to give a preview as to what you can anticipate on this call. Coming up next, we're going to have Stephen Picker and Meredith from Small Business Services. We want to make sure that you know what the small business resources are. There are so many resources that are coming together, hotlines that you can call, and also a new small business loan grant program that I really wanted to make sure that we communicated so that everybody knows how they can apply and access these really desperately needed funds. So we will have Small Business Services coming next. And then we will also be having Christian Klesner from the Office of Special Enforcement. This is someone who is out in the field and conducting the inspections and really can help you understand what to expect when you're being inspected. And any questions you have, you can raise them in the Q&A, and we are going to have a full Q&A after this. I really encourage you to ask the questions you've been wondering about. And then we will also have Joni, Commissioner Kletter from Oath, that if you do get a ticket, to understand all of the new innovations that the Trials and Hearings Office of this city has introduced during this pandemic to help navigate you through the summons and trials period. So, and also to speak on MEND. So I just want you all to just understand what is coming down the pike as far as information, and know that we are going to have a Q&A, and don't hesitate to ask any questions. These are the people that have the answers. So with that said, I'm going to pass it over to Stephen and Meredith to talk about the business resources that we have for you right now. Thank you.
Thank you so much, Ariel, and thanks everyone here for joining today. We know your time is incredibly valuable, especially at this period of time. So thank you so much for joining. So I lead a team at Small Business Services called the Food and Beverage Industry Partnership. I am a recovering chef owner with over 30 plus years of professional New York City restaurant experience, and I work with a small team of industry experts at SBS in the F&B partnership who are acutely aware of the challenges and the difficult path to recovery faced by business owners like you in this industry at this time. The Food and Beverage Industry Partnership at SBS works as an intermediary between you and your businesses and other industry stakeholders, as well as local government. We're here to make sure that your voices are heard and your priorities are raised in the development of all programs and initiatives designed to support this industry. We work daily to drive collaboration and partnership to get through this crisis and come out the other side better and stronger. And one of the rare silver linings I like to make sure and mention, because this time is full of really bad news, is the coalescing of the thousands of New York City food service businesses in this city, as well as multiple city agencies working together daily to support the recovery and stability and growth of this industry. So very quickly, there have been a lot of words here that you've had to digest. We know it's a lot of information. In addition to the Food and Beverage Industry Partnership, New York City Small Business Services is obviously an enormous collaboration of people working to develop services and resources for small businesses across the city. Some, very briefly, some of the sort of critical resources that we're currently offering, especially in this time, is the resurrection of our commercial lease assistance program, virtual business education through courses and webinars online. I'm sure you've already heard, but SBS has the small business hotline at 888-SBS-4NYC, and that is for any business related question, concern, issue. Please feel free to call that number anytime. We are currently continuing to offer virtual compliance consultations. So that is a no-cost virtual consultation to ensure that your setups are in compliance. And online, we are sort of housing the one-stop shop information under our restaurant reopening guide page, and that is at nyc.gov/restaurant reopening.
We're going to put that information in the chat, but definitely repeat the phone number as well.
For sure. So the hotline number again was 888-SBS-4NYC. And the reopening guide online was nyc.gov/restaurant reopening. I have asked Meredith Weber, the executive director of SBS's business outreach team, to join today. And she has been working tirelessly with some of the new financial resources that SBS just recently announced. And although I have some words about them, Meredith's words will probably be more enlightening for you. So Meredith, take it away.
Hi, everybody. Thank you, Stephen. Thank you, Ariel and Borough President Adams, for having us today and giving us the opportunity to speak directly with businesses who are impacted during these really horrible times. But also just a quick disclaimer, I'm thrilled that the construction industry is back up and running, but there is some construction happening in inopportune times right now next door. So apologies for any background noise, but while it's quiet, I'll try to quickly run through some of our new Lmi Storefront Funds that were just launched about a week ago. So these funds, there's 3 programs that were just announced, and they are targeting low to moderate income areas of the city, which we know were hardest hit by COVID and also significantly underserved by the federal funds that were distributed. And so these 3 programs are intended to help fill those gaps and reach the businesses in those specific zip codes, which we identified through housing and urban development data. So just very quickly, the 3 programs that we launched is the NYC Lmi Storefront Loan, the LMI Interest Rate Reduction Grant, and the Strategic Impact COVID-19 Commercial District Support Grant. The next, it's animated, so you just might want to switch to the next slide. But we're going to focus today on the NYC Lmi Storefront Loan because that is the program that is most relevant directly for small businesses to be eligible for. Just quickly, the interest rate reduction grant is through CDFI partners. Oh, you could, yes, you could say there. So businesses can't directly apply for that interest rate reduction grant. You will be notified, or you could reach out to your CDFI if you have currently any funding coming from them, and ask about this program, which reduces your interest rate owed. And the third product, the Strategic Impact Grant, that's specifically for nonprofit community development organizations, and it's funding to help support some commercial corridors in their areas. So next slide, we'll dive deeper into the Lmi Storefront Loan. So this is a zero interest loan for storefront businesses in low to moderate income areas of New York City, up to $100,000. And the funds are available for businesses to use as working capital to help restart or continue their operations. You could find more information and the application at nyc.gov/storefront loan. But we want to be super transparent about who is eligible, because we don't want anyone wasting their time, on a program that might not be right for them. But that said, if you are not eligible for this particular loan, if you go to nyc.gov/financing assistance, there's a tremendous amount of financial assistance and other resources that we could help connect you to. So if this particular product doesn't work for you, please reach out, and we can help connect you to one that is a better match. But like I said, this program is specific to certain eligible zip codes that are identified as low and moderate income neighborhoods across the city. You can find that list of zip codes at nyc.gov/storefront loan. Just some of them in Brooklyn include Brownsville, Crown Heights, Williamsburg, Coney Island, East New York. Here's the full list, but you could take a closer look on our website as well. Businesses must employ between 2 and 99 employees in total across all locations in order to be eligible. And you must have been in operation for at least 2 years. There's other eligibility on this slide, which I won't cover, but you can take a look. And again, it is on our website. The application process is in a few parts. You fill out an initial application on our website. Again, the website listed on this slide. You will be contacted after that initial eligibility application by a representative from one of our NYC Business Solutions Centers. And they will help walk you through the rest of the application and be your personal contact for any issues or questions you might have. Once that initial application goes through, we are working with a lender. It's Pursuit. So they're going to conduct a credit check and make sure that they're working to collect any documents that they may need. And then from there, the lender itself will communicate with clients about the next steps in the application process. One question that comes up is the credit score. It must be 625 or higher as an average across all business owners of the business. I think that is pretty much it. A business can't have any personal or business tax liens against it within the past 3 years. Yeah, and so I think that pretty much covers it. Again, if you need any more information, visit the website. As Stephen said, you could also call our hotline, who's available to connect you with any resources that might be able to help.
I'm always muted. Thank you so much, Meredith, and also Stephen. This is really just a nutshell of what all of the resources that are available through small business services. There's no way it can be covered here in its entirety. What I really want everyone to take away is that there is a phone number Monday through Friday from, I think, 9 to 5 with real live people that you can call with any question about running your business. And you call the number, it'll be in the chat, and small business live people can help you. And there's also the website that they put on there, which is a compilation of all the city and state agency information that is constantly being updated. You can go to that one link and get pretty much all of the answers and the information and guidelines that you're looking for. And then of course, you know, these are extremely painful, difficult financial times. That there is a loan possibility is important. And I really encourage you all to look into your own eligibility. And also don't forget that there's a lot of private grants and funds that are popping up all over the state and the country that you should also be exploring at this time. We will now move on to, I know, an issue that is important to everyone, which is inspections and what to expect when you're being inspected. I think there's a lot of emphasis on the outdoor dining structures, what is allowable, what is not allowable. We have Christian Klesner here from the head of the Office of Special Enforcement, who will give you a top list of what they are looking for, so you know what they're looking for, and we will also be able to ask questions directly to him. So please welcome Christian Klesner. Thank you so much.
Thanks, Ariel, and thanks to Borough President for hosting this and giving us the opportunity to connect with everyone on the call. It's very much appreciated. My name is Christian Klesner. I'm the Executive Director of the Mayor's Office of Special Enforcement, and we play a coordinating role for much of the enforcement related to COVID restrictions. I do want to say, you know, that touches on one of the very first questions I know that many folks have, which is who is going to show up. And this has been very much a citywide effort. So when I say OSE is coordinating, there are well over a dozen agencies whose inspectors are participating. And the important thing is that it is the city that is going to show up and check. I also want to say in context that, you know, the goals for enforcement are compliance, not to punish, not to, you know, extract revenue, but really to make sure that businesses are operating in a way that is safe for the employer, for the employees, and for the customers, so that customers feel comfortable going, so that we know that things don't get shut back down. This has always been the goal, to avoid the kinds of closures that are looming on the horizon. You know, the business community has really had champions both in Ariel and her office, as well as small business services, who are at the table in enforcement decisions citywide and playing an important role in contextualizing and sensitizing enforcement to the needs of the business community. I also want to say, and I'll say it up front just because I don't want to forget, that the Office of Special Enforcement plays another role related to the folks that I think are on this call, which is that when the city limited fees from delivery apps, such as Grubhub, Uber Eats, et cetera, OSE was tasked with that enforcement. And so I just want to make a quick plug that if anyone on this call is a restaurant using one of the delivery apps and you feel like you're being overcharged or charged more than they're limited to, you can email food service tips, that's all one word, food service tips at ose.nyc.gov. We are conducting industry-wide investigations and looking to protect people, and have actually gotten restitution for overcharges for some folks already. That being said, I know that there, you know, the main interest is in what is it we're looking for. I want to say overall, you know, if you're a regulated industry, please look at the state guidelines. They're extensive. You're responsible for complying with all of them. But from an enforcement perspective, we understand that, you know, there's some very important things that we are looking for, that we worked with the Department of Health to really focus on. You know, what are the most important things that tie to the core four that Chelsea talked about earlier, that can be easily viewed by any city inspector without, you know, without technical expertise, and that can be addressed and reviewed relatively quickly so that the inspections are over and done with as quickly as possible, both to not take away from the time that you all need to run your businesses, but it's to also minimize the time that you have an inspector in your business and instead of paying customers. So let me just run through quickly what some of those questions are for any kind of business that we're doing a business inspection on. We're looking to make sure that the required safety plan is available for review. We're looking for signage to remind personnel to adhere to proper hygiene, social distancing rules, to use PPE, and have cleaning and disinfecting protocols. We are very focused on making sure that employees are complying with face coverings. We'll be looking for markings, 6 feet markings where people are forming lines and gatherings, for designated areas for pickup and delivery. We'll be checking to see if the bathroom has soap and paper so that people can do appropriate hand washing. We're looking for a log of cleaning and a daily log that describes the cleaning and the scope of cleaning. We'll be making sure that the business is providing replacement face coverings for employees, and we'll be looking to make sure that there is evidence of a health screening and process. I probably should have started this. Everyone can hear me okay? Okay, great. I've had a lot of technical issues in the past, and so I just want to make sure. Thank you. So those are the questions we're asking of all businesses. In addition, for indoor, now that once indoor dining was allowed, we were also checking for some specific things for indoor dining. I'll run through those quickly as well. We're looking to make sure that there was signage about maximum occupancy and where to file a complaint. We were very focused on making sure that the number of indoor occupants is at or below 25%. We're looking to make sure that thermometers are being used to screen the indoor dining patrons, that the business is collecting contact information for one member of each party, that they're storing that information for at least 28 days. That tables were limited to 10 patrons, and obviously for businesses that have been in zones, that changes. So whatever the zone requirement is, we're checking and looking to make sure the tables are spaced 6 feet apart or separated by barriers 5 feet tall, that silverware is prepackaged or pre-rolled, and looking at the ventilation systems to see, are they in compliance? That part's a little murky, and I can touch a little bit more on that if needed. Please know that we're looking, when it comes to ventilation, we're looking for best practices and have instructed folks that should never be the basis of a violation, since we know that there's real limitations on the availability of the high-end filtration systems, and that the guidance is pretty amorphous on what best practices mean in the absence of central air. And we're very much also looking to make sure that the restaurant's complying with bar seating rules. If there's alcohol served at a bar, you can't have dining customers there as part of indoor dining. More recently, we have also started checking on the outdoor dining. I know that as winter came, a lot of outdoor dining areas started getting closed up. And let me just be clear: if there are 3 or 4 walls on an outdoor area, it's not outdoor anymore, and it becomes an enclosed indoor dining. And the indoor dining inspection list that we just said, including 25% occupancy, becomes part of that inspection. So the outdoor areas, if you're looking to maximize your seating, really need to be open on 50% around on the walls. So the outdoor checklist includes whether the outdoor area is enclosed. We're looking at what kind of material it is. Does it have a roof? Is it enclosed on more than 2 walls? That the roadway seating has roadway barriers that are 18 inches wide. That the roadway seating has a fully built interior and bottom wall, and that barriers are filled with sandbag and soil. I will add that the inspection forms, and every inspector that is coming is using a form, an online form that goes through and directs them to ask the same questions that I just read out to everybody else. I want to, for the outdoor enclosure ones, I want to highlight that when the answer to any of those technical things is no about soil or barriers, the inspectors are asked to inform the owner or manager to comply by December 15th. And so, that is part of the prompt that they're, to be asking the person in charge, hey, do you know about this? Make sure you come into compliance soon. And so those are the questions. So I hope folks can see that these are not overly technical questions. Obviously some of the outdoor enclosure parts get a little more precise, but these things are not gotchas. Like I said, we're not, we would prefer to not ever issue a violation, because I think of the participation of Office of Nightlife and SBS, and also our, just a general administration-wide commitment to helping businesses stay open as much as possible. We've really prioritized that inspections result in education and warning, right? That this is deficient, please fix this. And we've even now, and so in general, we issue very few violations, and violations should are generally not going to be issued unless you've gotten a couple of warnings. There are certain egregious situations. If you're at 100% indoor occupancy or anywhere close, you should expect that there will be a violation right away. And if if your employees are not wearing masks, you should expect that you're going to get a violation. For most of the other things, you should certainly get a warning ahead of time. And we've also now, let me say just a couple words and I'll pass it back about how the city's inspecting. We do receive complaints through 311. Those are likely to be inspected by one or two agencies. We are doing proactive enforcement along corridors, especially in the zones, to make sure that everyone is compliant in the zones. And then we are working our way through the list of approved outdoor dining establishments to ensure that the outdoor structures are in compliance. And a lot of that is DOT and a handful of other agencies. So, I also want to recognize as the enforcement, we understand that inspections can be stressful, that people are fearful of violations. I just encourage everyone to, when someone comes in, treat them with respect in the same way that you would expect them to be respectful to you, hear them out, look to see where you can comply, and know that a lot of times even someone just walking in doesn't mean that there was a negative outcome. I've gotten a lot of questions from people who say, what happened at this inspection? Maybe it wasn't clear at the time, but they were actually in full compliance. And so I just ask that people, trust the process. If you do get a violation, they are contestable. I will say if it's a thing that you think as a matter of law you shouldn't have gotten, like it says you're in a red zone and you are not in a zone, there are ways to actually have those reviewed up front. But for the most part, if you disagree with the facts, you can litigate those at oath. And I think, let me stop there, pass it over to oath, and I'm here for the Q&A after.
That's a perfect segue. Thank you, Christian. We really appreciate you being here. Really, it's so important to be able to demystify the inspection process and really understand what you are all looking for. I think it was very helpful and clear. So thank you for that. And yes, it's the perfect segue to Joni Clutter, who is the commissioner of, oh yes, I'm going to get it exactly right. The Office of Administrative Trials and Hearing, which is OATH. You all know it as OATH. And she is the new commissioner, and I'm happy to introduce her to all of you right now.
Thank you. Good afternoon, everyone. Thank you all for joining us. For those of you who don't know much about OATH, we are an independent and impartial administrative tribunal. And our hearings division is responsible for adjudicating the summonses that are issued by over 20 enforcement agencies throughout the city. So that includes sanitation, transportation, parks, buildings, consumer affairs, and health, just to name a few. We generally process about 800,000 summonses a year. And of those, about 300,000 come to OATH for a hearing, for an in-person hearing. So it's a massive operation. And as I mentioned, we're independent, and in many ways, we are a check on the agencies. Our hearing officers will only impose a fine if the agency can show that it served the summons properly and prove its case at a hearing. In fact, over 40% of summonses are dismissed by our hearing officers at OATH. When I arrived at Oath the same week as the city was shutting down because of COVID, we immediately transitioned from doing in-person hearings to doing remote hearings. And I'm proud to say that we've now done over 70,000 remote hearings since mid-March, which is, we're probably the busiest court in the country. I think that's the most hearings that any court has done anywhere. So I'm really proud of our team for keeping Oath fully operational during this time, because we never stopped working. And our telephonic hearings are super convenient for respondents. If you get a summons, you can now contest that summons from the convenience of your own home. You just need to pick up the phone and you can schedule your hearing on a date that is convenient for you. And I encourage you to reach out to our help center prior to attending any Oath hearing. We have a very robust help center. The center did not exist a few years ago. We now have over 25 people in our help center, and their goal is to help respondents navigate the hearing process. So they will tell you what documents you would need to show to the hearing officer, what arguments you should make at the hearing, how to file an appeal, how to file a motion to vacate a default if you didn't show up. And it's very convenient and easy. And we've done over 16,000 remote hearings since mid-March. This summer, I also launched a dedicated small business help center within the Oath Help Center. So we have a dedicated email address and webpage specifically for small businesses that need specific help around the types of violations that they are seeing in their businesses. We've also worked to become more technologically innovative so that in addition to our remote hearings, we now have a text message system that we just launched. So if you have any questions about your summons, you can text us 474747, text Oath reminder, and we will tell you when your hearing is and other pertinent information regarding your hearing automatically. And we have a very robust language access program. In addition to translation services at the hearing, we will translate documents for you and assist you in reading documents. Finally, as Ariel mentioned, we recently launched Mend NYC with the Office of Nightlife. We've successfully mediated about 20 cases so far, which is great because it's only been 3 months. And it's a citywide initiative to provide free mediation services for small businesses in particular who are struggling with neighbors that have made quality of life complaints, as well as potentially landlords around lease and back rent issues. So I encourage you to take advantage of this free voluntary service. It's had a lot of success so far. And that's my spiel. Happy to take questions.
Thank you so much, Joni. And I think it's important to point out the marriage really between the enforcement and oath office. As Christian was saying, you know, enforcement is often complaint driven, right? And so if you have a neighbor who is calling 311 often, you will tend to get more visits for inspection. And if it's something that needs to be brought to your attention and compromise and understanding can be had through a mediation process, it can also help to resolve the issue with the complainant and also to minimize the need for enforcement and inspection if you resolve the issues and get into compliance through that communication. So it's really important that we have introduced this mediation program, and what Oath has done to help with the hearings process so that people can be in their own home, get text messages, and really have the help and support and information to get through the process is invaluable. And I thank Christian again for really taking, seeing behind the curtain of what inspectors are looking for. So it's not so overwhelming and mysterious when they arrive. At the end of the day, I think it's important to just emphasize that all of this is to make sure that there is safety and health and security, and that we are all just doing our best and complying as best as we can to keep the numbers down and to get through this. We are just going to go into the Q&A right now. I just wanted to bring up one aspect from Christian's standpoint. There is a looming possibility, of course, in regards to the potential closure of indoor dining temporarily before there is a stabilization of hospitalizations. That is not imminent. It is the rumors in the air. But I wanted to emphasize that if you do have outdoor dining that is enclosed, and in the event that hypothetically that indoor dining was suspended temporarily, you really should be making sure that your outdoor structures have both sides open so that it can be used as outdoor versus indoor dining, and you'll still be able to use it in compliance. I wanted to just emphasize that. But with all that said, we will turn it over to Jose right now. Thank you all for your incredible presentations. I really hope it was helpful to everyone. And Jose can share the questions that have been coming in.
Thanks, Ariel. You just answered one of them. There were a couple questions regarding what possibility of closing on Monday, but sounds like you addressed it. Just as, go ahead.
The question to emphasize about whether it's going to close on Monday, we don't know. I just want to emphasize that it's really hard to be able to have a crystal ball. All of the decisions that the state and the city make are really based on the metrics of what the hospitalization and other data. And so we know that it's a possibility. We see what's going on around the country and the world. We as New Yorkers are going to do our best with the information that Chelsea and Department of Health has shared with us to keep those numbers down, to keep our doors open. But it is a possibility, but when that happens is really up to the state.
Thanks.
Can I offer something else on that? That's an important point that I think I failed to make in my presentation, which is that I don't have any insight into how the state is conducting inspections other than to say, I know that they are, and I know that there are sometimes doing it in the same areas that we are. We know that state inspectors have come sort of back to back with city inspectors. So everything I have said applies to the city inspectors. I don't have, nothing I've said applies to the state inspectors. They have a different process. The fines that folks might get from the city are generally $1,000 fines for violations of Health Code 3.07. The state fines, I think, are significantly more. They're a multi-page violation form instead of a small violation that looks more like a ticket. That is what you would get from the city. And so I'm glad I remembered to make that point, because I think, a lot of businesses have said we keep getting repeat inspections. I think sometimes it is the state coming in. The city has actually taken steps to make sure that inspectors can see the results of the last inspection when they're entering in the form and going through the questionnaire that I mentioned. And they're now being trained that if the last inspection was compliant and within the past week, to skip the inspection. So if you've had a compliant inspection, you may not even get another inspection from the city for 7 days, but it could come from the state.
Thank you for that clarification, Christian. And again, I think it's important to, from what I hear, very often people tend to feel very overwhelmed right now by the amount of inspections that are happening. And there's so many different agencies, it's city and state. People feel targeted and victimized in addition to trying to just get by every day. And I want to really, first of all, say, as a former bar owner for 10 years, I understand that frustration, but we have to also recognize the time that we're in, which is unlike any other time in history, and that truly the inspections that are occurring right now are just to make sure that things are safe. We have people dining in the streets, in these handmade structures. We have a highly contagious virus that comes through the air. And so I hope we can all be seen as a team working together to get the city out of this rather than us against each other. And I hope that this town call can help to emphasize that need for cooperation and understanding and working together to get through this. But of course, you know, we're also here to address any issues that may arise at any time and any questions. So let's have another question, Jose.
We have a quick follow-up to the point that Christian just made. Angie is asking, what are the state agencies that might be out doing inspections? Who should they be looking out for?
Certainly, if you have a liquor license, the state liquor authority has been pretty robust in enforcing provisions. If you have a liquor license, I really take the time to be very, very careful. They will take the liquor license, and we know what a burden that is to the business and to the life of a business. And so, you know, really make sure you're looking at the state liquor authority website. Make sure you're asking them for guidance. Make sure you're crossing your T's and dotting your I's. The State Department of Health is sending out folks. State troopers have been involved, although that's more relating to mask usage. Those are the ones that I know of. I don't know if any of the other panelists are aware of any other agencies.
Maybe the sheriff's office, but that's in the city, right? Okay, Jose, do we have another?
Yep, it looks like several of the questions have been answered in the Q&A box. So if you did have a question, some of our colleagues at different agencies have been entering answers to those questions. So take a look there. We do have another question about closing hours and if there might be a special allowance for 1 a.m. closing hours on New Year's Eve. The point being that unregulated private gatherings might be more dangerous or more risky.
You know, this is another point I wanted to make before, because I saw some of these questions said, what would the city do? You know, as Ariel intimated, we don't have full insight into when the state is going to apply the rules, but it is important to note that the state is in the driver's wheel, that they set the rules and the regulations. They're the ones setting the restrictions on time. There are very, very few instances in which the city has taken extra steps beyond what the state requires. And I don't think, other than particularities around the outdoor dining requirements that allow people to have these roadside spaces, I don't think that the city has actually been more restrictive than the state. So I think the closing time issue is a state question. How long restrictions are going to be in place is a question for the state. Not to say that we won't know the answer once we know, just they're the ones making these decisions, and then they get handed down to us to enforce.
Thank you, Christian. And I do know the New Year's Eve question has come up, and you know, in COVID time, December 31st is multiple lifetimes away in a sense, but I also know that as operators, you need to know with as much time as you can get to make plans for people to celebrate. And your point is very well taken about the need to be able to allow for regulated gatherings to avoid the underground scene that might potentially arise. We do leave it into the hands of the state to make the determination on the hours, but I want you to know that this concern is going to be communicated so that it is taken into consideration when those decisions are being made.
And you know, as we're talking about large gatherings, I just want to say that the state has imposed and authorized $15,000 penalties for hosting illegal gatherings. Be very clear about what the restrictions are for occupancy and don't go over them. That is another area where we are being very quick to issue summonses. And in fact, if there are also then violations related to the alcohol and beverage container law, there could be criminal summonses. So please be very mindful of what the limits on legal gatherings are for your zone, and don't host parties that go beyond that.
Yeah, the capacity for private gatherings that are not within a licensed establishment are what, 10 people now? Is that what the
In private residences, yeah.
private residences? And so, there is always this issue and question around capacity versus how many people can you have in a private gathering. That website that is up on SBS's website has the state and city guidelines. You can go directly to the state website as well. To Christian's point, this is a time of sacrifice, really, for all of us. None of us want to be in this position. It's highly financially crippling, emotionally crippling, but it is temporary. We will get through this. This is a moment in time that is extremely difficult and restrictive. But if we have the discipline to follow the guidelines in order to not let this virus take us over, but that we can take it down, then I think we just have to continue to just hold on until we get through this, inevitably with light clearly at the end of the tunnel past this winter. Jose, do we have one other question?
Looks like there's one final question about the possibility of additional federal aid, whether there might be another round of the Paycheck Protection Program or other federal assistance.
So this is obviously the number one question on a lot of people's mind. As we know, it's not a city or even state decision. This is a federal government effort. I think as we're all watching the news, we can see that there is communication and reason for hope, that they will understand through compassionate leadership and understanding of what people are going through right now. This is the hardest time of our lives. And the best that we can do is to make sure that you and all of your patrons and constituents in the community are really communicating to the federal government through your representatives. Let them know what you need. I think it's important. New York City and the nightlife and hospitality community, we make up thousands and thousands and thousands of voices and lives. And it is important that at this time right now, when the decisions are being made, that you reach out to the federal government and let them know what you need right now as they're making these decisions. But I do think there's reason for optimism and hope that we will get those funds sooner than later. But again, it is really not in our hands. But there is cause and reason to believe that it is coming. And we will all wait and see and hopefully be active in advocating for that together. The Office of Nightlife has been advocating for the Restaurants Act as well as the Save Our Stages Act. These are two bills that have been included and accepted into the HEROES Act at the House of Representatives. It is on the table. It not only includes the PPP and the extension of unemployment insurance, but it carves out additional funds and grants specific to the hospitality community. It is being led by NIVA. NIVA, you should go and check out their website and see how you can get involved. But there is a big effort and a lot of support by our city representatives and nationally, all the way up to Washington, to include the Save Our Stages Act and the Restaurants Act to really help save this industry. And we know that at the end of the day, money is the lifeline and that it needs to come from the federal government. So we have a lot of work to do to just stay mentally positive and focused and optimistic, and to use the resources that have been shared with you today to hunker down and to hold tight as we make our way through this towards the light that we see at the end of the tunnel with the vaccine development, rapid testing, to Department of Health and Test and Trace's earlier point. In the early days, no one was able to get tested. And now thousands of people are able to get tested. And that is really the key to help us get through this. So I hope this was helpful for you all today. I don't want you to hesitate to reach out to any of us. At all times, we are here for you. You are not alone. You are seen. We know that you're suffering, and we want to do everything within all of our power to help you to get through this. I want to just remind you, we are doing another town call next Tuesday at noon. The Office of Nightlife is doing a multi-agency town call similar to this, but for your workers, for the staff and employees that you have, for the freelancers, the DJs, the event planners, to help give them also information specific to help guide them. And we will ask you to share that information. We are here for you. Please reach out. Please stay positive. Please stay safe and healthy. And just know that you can reach out to our office and we will connect you with any city agency that you need help with right away. And we wish you a safe and happy holiday. It's a time to, just be grateful for what we have and have hope that we will rise again stronger and better than ever. So wishing you all the best, happy holidays, and never hesitate to reach out. Thank you all. Thank you to every single colleague here today. And thank you again to Borough President Adams for creating this space for us to gather today. I hope it was helpful. Thank you.
Thank you.
Thanks, everybody.
Thank you, Evan.